Ever picked up a new medication or maybe saw like a promising headline about some new therapy? Or even just wondered how we really know if a treatment actually works?
Hmm.
Well, today's deep dive is going to take us behind the scenes of medical research
Okay.
to explore this thing called blinding.
Interesting.
It's a technique that's all about making sure that those studies are giving us reliable results.
Right.
And our guide for this deep dive is an article from VIARES,
Uh-huh.
which is an organization that provides clinical research training.
It's a bit like a detective trying to solve a case
Right.
without knowing all the clues beforehand.
Interesting.
Like if researchers know who's getting what treatment,
Yeah.
they might unknowingly interpret data in a way that supports their assumptions,
Oh, wow.
even subconsciously.
So it's like a safeguard against jumping to conclusions.
Yeah.
Tell me more about how this blinding thing works.
So imagine a study testing a new drug for high blood pressure.
Mm-hmm.
Some people get the actual drug,
Okay.
and some get a placebo that looks exactly the same.
Gotcha.
The key is that neither the participants
Yeah.
nor the researchers
Wait.
know who got what.
Okay.
That's what we call double blinding.
Okay. So it's about keeping everyone in the dark,
Yes,
like a surprise party for science.
exactly.
Okay.
And this double blind approach is like the gold standard in research
How come?
because it minimizes the risk of bias creeping in.
Oh, I see.
Think about it. If researchers knew who was getting the real drug,
Yeah.
they might pay more attention to those patients,
Hmm.
ask them leading questions about their symptoms,
Hmm.
and even interpret improvements more favorably.
Wow.
That's what we call performance biases,
Oh, okay.
where actions influence the outcome.
Wow. I hadn't thought of it that way.
Right.
So it's not just about the data itself.
No,
It's about how that data is collected and analyzed.
precisely.
Okay.
And then there's detection biases,
Right. What's that?
which comes into play when researchers are interpreting the results. If they know who received the real treatment,
Mm-hmm.
they might unconsciously look for patterns that confirm their expectations,
Wow.
even if the data is actually ambiguous.
That's kind of scary. Our own brains working against us.
Yeah.
So double blinding is like the shield
Yeah.
protecting the integrity of the study.
Exactly.
Okay.
But it's not always as simple as just saying, okay, everyone close your eyes and don't peek.
Huh?
There are different levels of blinding, each
Oh.
with its own intricacies and challenges.
Okay, this is where it gets really interesting. Like levels of security in a spy movie.
Yeah.
What are some examples?
Well, we've talked about double blind,
Yeah.
where both participants and the researchers are in the dark.
Right.
But sometimes you have single blind studies
Mm-hmm.
where only the participants are unaware of their treatment.
Oh,
For instance, think about surgical trials.
yeah.
You can't exactly blind the surgeon performing the procedure.
Right. That makes sense.
Yeah.
So in those cases, they'd focus on blinding the people, assessing the outcomes.
Right.
Maybe those evaluating how well the patient recovered.
That's a great example of how researchers adapt blinding to different situations.
Interesting.
They're always trying to strike a balance between minimizing bias
Yeah.
and ensuring the study is still feasible and ethical.
So it's not a one-size-fits-all approach.
Not at all.
Okay.
And there's even a triple blind scenario
Oh, wow.
where the participants, the researchers administering the treatment,
Yeah.
and the folks analyzing the data are all kept in the dark.
Wow.
This is like the Fort Knox of research security.
Wow. Talk about high stakes. But when would you actually need that level of blinding?
Think about studies with outcomes that are more subjective,
Okay.
like pain levels or quality of life assessments.
Okay.
If the people measuring those outcomes knew who got the real treatment,
Right.
their own biases could creep into how they interpret and record the data.
So it's like adding an extra layer of protection?
Yes.
To make sure the results are as objective as possible.
Exactly.
But I imagine triple blinding must be super complicated to pull off in practice.
You're absolutely right.
Yeah.
It's a lot like coordinating a complex dance. And as you can imagine,
Yeah.
it can get quite costly and challenging to implement,
Right.
especially for studies with large numbers of participants.
This is fascinating. So blinding is this essential tool for reliable research,
Yes.
but it's not without its hurdles.
True.
What are some of the other challenges researchers grapple with when trying to keep everyone in the dark?
Well, sometimes,
Yeah.
despite everyone's best efforts,
Mm-hmm.
the blind can be broken, which we call unblinding.
Oh,
For
Oh.
example, a treatment might have very distinctive side effects
What?
that tip off participants to what they're receiving.
Oh, so it's like a detective accidentally revealing their presence to the suspect.
Yes.
That must throw a wrench in things. Tell me more about these unblinding moments and the impact they can have on a study.
It certainly does. Unblinding can reintroduce the very biases blinding was designed to prevent.
Oh, wow.
It's like letting the suspect peek at the detective's notes.
So what can researchers do? Is it a constant battle to maintain the blind?
You could say that researchers have to be incredibly vigilant.
Yeah.
Use all sorts of strategies,
Like what?
from creating placebos that mimic the real treatment
Okay.
to using coded medication so even the people administering them don't know what's what.
I imagine things like distinctive side effects must be a real headache.
Oh, yeah.
Can you give me an example of how researchers might try to get around that?
Let's say you're studying a new drug that often causes a dry cough as a side effect.
Mm-hmm.
Researchers might try to incorporate something into the placebo that also causes a mild cough.
Oh.
It's all about making the experiences in both groups as similar as possible.
So it's not just about keeping information secret. It's
Yeah.
about carefully controlling every aspect of the study
Yeah.
to minimize the chances of anyone figuring out who's getting what. Wow.
And it goes beyond the physical treatments themselves.
Oh.
Researchers also have to be mindful of how they interact with participants.
Right.
They might use standardized scripts or questionnaires
Yeah.
to ensure everyone receives the same information
Yeah.
and isn't inadvertently given clues about their treatment group.
And it sounds like there's a lot of pressure on researchers to maintain this delicate balance.
There is, and sometimes,
Yeah.
despite their best efforts,
Yeah.
unblinding is simply unavoidable.
Oh, wow.
Think about a study comparing a new type of physiotherapy
Okay.
to a standard exercise program.
Mm-hmm.
It might be very difficult to mask the specific movements or techniques involved in the new therapy.
Right. So there are limitations to what blinding can achieve,
Yeah.
especially when dealing with procedures or therapies that are difficult to disguise.
Absolutely. But even in those cases,
Yeah.
researchers can still try to blind other aspects of the study.
Okay.
For instance, they might blind the people assessing the patient's progress. So their evaluations aren't influenced by knowing who received which treatment.
So it's about finding creative ways to apply the principles of blinding wherever possible,
Right.
even if you can't achieve complete darkness across the board.
Exactly. And I think that's a key takeaway for our listeners as well.
Yeah.
When you hear about a new study
Yeah.
or a groundbreaking medical discovery,
Mm-hmm.
remember that blinding plays a crucial role in ensuring the reliability of those findings.
So before we get swept away by the excitement of a new treatment or headline,
Yes.
it's worth taking a moment to ask ourselves, was this study blinded?
Yeah.
And if so,
Right.
how effectively was it done?
Precisely understanding the role of blinding can help you become a more critical and informed consumer of medical information.
This has been incredibly insightful. We've uncovered the importance of blinding in research,
Yeah.
explored its different levels and the complexities of implementing it,
Yeah.
and even delved into the challenges of maintaining the blind.
We've seen how blinding acts as a shield against bias,
Yeah.
safeguarding the integrity of research
Right.
and ensuring that the findings we rely on are as trustworthy as possible.
But as we've discussed,
Yeah,
blinding isn't a magic bullet.
it's true.
It has its limitations.
Yes.
And researchers are constantly battling against the potential for unblinding.
Mm-hmm.
So what does this all mean for you, our listener?
Right.
How can you apply these insights to your everyday life when navigating the constant stream of medical information? It's like we've gotten this like a behind-the-scenes pass to the world of research,
Yeah.
seeing all the effort that goes into
Right.
making sure the results are as accurate as possible.
And now you can use that knowledge to your advantage. The next time you come across a news article touting the latest medical breakthrough,
Yeah.
or a friend swears by a new supplement they're taking,
Right.
don't just take it at face value.
So it's like being armed with this secret decoder ring
Yeah.
that helps us decipher the world of medical claims.
Exactly. Ask yourself, how do they know it works?
Right.
Was there a study?
Okay.
And if so, was it blinded?
Because even if something sounds amazing,
Yeah.
if the research wasn't carefully designed to minimize bias,
Right.
we should probably take those results with a grain of salt, right?
You got it. Now, it's important to remember that not all studies can be blinded.
Yeah.
sometimes it's just not feasible,
Right.
especially in certain areas like surgery or physical therapy.
Right, like we talked about earlier.
Yeah,
You can't exactly blind the surgeon in the operating room.
exactly. But even in those cases,
Yeah.
you can still look for other signs of a well-designed study.
Okay.
Things like a large number of participants,
Yeah.
a clear comparison group,
Mm-hmm.
and careful measurement of outcomes.
So it's not always a deal breaker if a study wasn't blinded,
Right.
but it's definitely something to keep in mind when evaluating the strength of the evidence.
Absolutely. And don't just stop at one study.
Oh.
Look for patterns across multiple studies. Do other researchers find similar results?
Mm-hmm.
Or are there conflicting findings?
That's a good point. It's all about getting the full picture,
Yeah.
not just focusing on one isolated piece of the puzzle.
Precisely. And remember, research is an ongoing process.
Mm-hmm.
New findings emerge all the time.
Mm-hmm.
So stay curious and keep learning.
Yeah.
Organizations like VIARES that we mentioned earlier
Right.
offer great resources for those who want to delve deeper.
It's been an incredible journey behind the scenes of medical research.
Yeah.
And I feel like I've leveled up my ability to critically evaluate the information that comes my way.
And that's what it's all about.
Right.
Empowering you to become an informed and discerning consumer of knowledge.
So the next time you see a headline about a miracle cure
Mhm.
or hear a bold claim about a new treatment,
Right.
remember the lessons we've learned about blinding.
Yeah.
Ask the right questions, think critically,
Right.
and don't be afraid to dig a little deeper.
Because ultimately, it's your health and well-being that's at stake.
Thank you for joining us on this deep dive.
Appreciate it.
Keep those curious minds engaged.
Yes.
And we'll see you next time for another fascinating exploration of knowledge.